Hey, Dr. Augustine here from Head to Wellness. Today's topic, cardiovascular wellness. We're going to talk about the statistics behind cardiovascular disease and why it's the #1 killer today. We're also going to talk about what's causing it, why it's such a significant problem today, and also provide you with solutions. Stay to the end because I'm going to give you some clinical pearls on how you can start today reversing this process as well as preventing it. Hey, this is Dr. Augustine from Head to Wellness. Today's topic, cardiovascular wellness. Very, very important topic because it affects everyone. So we're going to talk about the statistics behind it, why that's so important, what's causing cardiovascular disease, and then the discovery process and how do you know where you're at with things like that, and then some solutions. Statistics, terrible. The #1 cause of death today is heart disease. #1 cause. Over 841,000 people die every year from cardiovascular disease. And here's a connecting the dots cause. 1 out of every 3rd person is pre-diabetic. So what does that tell you? Blood sugar problems cause heart disease. 3rd point, completely preventable and or reversible. So let's continue. We're not going to talk about all the causes of heart disease, but the main causes. Blood sugar problems and seed oils from something that you would eat, right? Seed oils, we've all heard that, don't eat fat because fat's bad for you. Well, guess what? There are some fats that are bad for you, and that would be seed oils, canola oil, sunflower, safflower, corn oil, things like that. Not really healthy for you. So what should you do instead would be grass-fed butter, ghee, olive oil, nut oils, avocado oil, great fats for you. Okay, next level as far as a cause is obesity and weight gain. And guess what they're caused by? Well, guess what? Blood sugar problems. So that whole idea of eating low carb is critical and foundational to trying to stave off heart disease as well as obesity and weight gain. So the only thing that actually causes you to gain weight would be lots of carbohydrates in your diet. Certainly your thyroid can influence that as well, but I'm talking from a plain, simplistic perspective. Carbs are the problem. Thirdly, high blood pressure. High blood pressure. So imagine this. Imagine taking a balloon, blowing this balloon up to the point where the walls of the balloon weaken, and what does the balloon do but pop? So imagine that being your blood vessels, and similarly, you could have a stroke, or you could have enough pressure inside your blood vessels to where you couldn't perfuse blood into your vital tissues, such as your brain, hence a stroke, or a transient ischemic attack. Or you can prevent, by having high blood pressure, you can prevent good perfusion of blood into your heart tissue and therefore have ischemia and potentially cause a heart attack there too, just with blood pressure. Instead of just treating the blood pressure, that's good to do at certain times as well, try to find out what's causing blood pressure problems. Lastly, smoking. Smoking is a big deal. Smoking, I'm not sure why people still do it. Some people didn't get the memo, I guess, but smoking actually is carcinogenic, causes cancer, but it destroys cardiovascular tissue and it constricts blood vessels. Not good. So the discovery process, how do you know what's going on and what should you do about it? But certainly from the perspective of how do you know what's going on, when should you start looking? Should you wait till you have full-blown heart disease? Because unfortunately, here's another great statistic to remember. This is from the American Heart Association. The #1 symptom of a heart attack, 50% of the time, is no symptom. Massive heart attack, you're gone, you're in heaven, and that's it. So not a good idea to wait to have symptoms. We like to say, let's discover things when they're small, because smaller problems, when you're heading in the wrong direction, it's a lot easier to turn that process around. So let's continue. Lipoproteins, cholesterol. Cholesterol happens to be present during heart disease but doesn't directly cause heart disease. So let's talk about this. So really some advanced testing that we like to do would be advanced blood work. It does look at the lipoprotein particles from small density lipoproteins, LDL 4 and 3. We have total LDL particles. We have triglycerides, which, as you know, triglycerides actually demonstrate overt sugar intake in your body. We also have some other tests that look at vascular inflammation, such as C-reactive protein, homocysteine levels. These are directly causing damage. These are inflammatory markers that show up that actually cause damage to your cardiovascular tissue. But the major thing that contributes to it is here, looking at blood sugar. Not just your blood sugar, glucose, and your A1C test, but a lot more. Insulin is so critical and foundational to discovering what's causing damage to cardiovascular tissue, and that would be insulin. Insulin is almost corrosive, meaning it burns and damages tissue, your cardiovascular tissue. So we want to check that and analyze it very well, such as fasting insulin. Your fasting blood glucose would be good. A1C test is the last 3-month averages of your blood sugar, but homa-ir is also good. EAG, C-peptide, really good. Adiponectin, leptin, and some of those things. Those are way more comprehensive to really understand where you're at with regards to blood sugar. And therefore, you can start to begin to reverse that process. Because prediabetes, insulin resistant, can still cause the same cardiovascular damage as diabetes does. Another type of testing that we have here in my office is called a Multi-Scan Pro. I like to call it the full body scan because it does look at just about everything. Brain and parts of the brain, thyroid function, heart, great cardiovascular marker. It also has some pre-diabetes and diabetes testing built into it as well, and it's not an invasive test. Great test. So there's cardio disease screening, looking at LDL cholesterol and inflammatory processes. Also, here are some pretty advanced markers. Microcirculation, called a pseudomotor test, looking at the small tiny capillaries, and this is a cardiovascular marker demonstrating blood sugar problems. Endothelial score, measuring and testing the inner skin lining of your blood vessels. If that score is going south and having problems, you are having blood sugar problems. Within this other test, within the same test, lifestyle score. Lifestyle score demonstrates nitric oxide levels. Nitric oxide, if it's in good normal supply, it's created by the inner skin lining of your blood vessels called endothelium. And if it's in normal supply, it's protecting your cardiovascular tissue. Good thing. Also, if it goes low, then you're causing damage within cardiovascular tissue. Another thing, oxidative stress. You've heard of oxidative stress. We take antioxidant vitamins to try to get rid of it because it's damaging to our tissues. It wears our body out, makes us age, causes cancer, but it also is destructive to cardiovascular tissue. And what's one biochemistry pathway that creates it? Blood sugar problems. So fix the blood sugar problems, guess what it drops down? Oxidative stress levels. But we can actually measure that on this kind of testing. Major test, wonderful, amazing test. Everybody should do this. It's called a heart scan or a coronary artery calcium score. It's a CT scan of just your heart to measure the calcium content in your coronary arteries. Beautiful score, beautiful testing. There's mild levels, moderate levels, and severe levels of calcium that can be in your heart. You could also, the best result from this would be no calcium in your heart. So it doesn't really matter if you have small amounts, medium amounts, or large amounts. You definitely want to deplaque your arteries, and you can do this without doing open heart surgery. Bypass surgery, you can actually take nutrients to deplaque your arteries, non-invasive, and actually your body will provide back to your body what's missing, take away things that are interfering, and your body changes and improves, and you heal. This test is amazing. It's an in and out type of test. You walk in and you get the test. You're not put into a tube. This is actually a big donut, and they hook a 4-lead EKG up to you to really make sure that your heart rate's not too fast. Because if your heart's beating too fast, it tends to blur the image of your heart scan. So we want to make sure your heart rate is normal. So You do the test, we get the results, and we can see where your score is at, and you can start to reverse things. So here is an example of a heart scan or coronary artery calcium score. So on the left side here is no calcium, and then on the right side is calcium risk. It shows it right there. See the white areas right there? Now this next picture shows no calcium on the left. CAC score is a 0, but on the right side it's dreadful. It's at 1200. So you can see all these white areas of calcium here, here, out through here, and over here. Not good. Even at that level, you can reverse and completely deplaque those arteries. So here is our sequence for heart wellness or cardiovascular wellness. First off and foremost, let's discover what's going on and where you're at with things. So advanced blood work we would do. We would also do a heart scan or CAC score. And thirdly, a multi-scan pro, which was done right here in our office. It's not invasive, it's not painful, it's not embarrassing, it's an amazing test. And that kind of picture demonstrates and will show us very accurately on where your heart wellness is at. Now, does this process, by the way, replace your doctor's treatment or care of you? No, absolutely not. Whatever they're doing to help you is probably pretty amazing to keep everything under control. But our part of it is we like to begin to work at those foundational levels of what's ultimately causing things. Because if you can start healing and repairing your body tissues, then there's less of a need for medication, and the whole process unravels and your body's going to be healthy and well. Sound good? Makes sense. Let's talk about solutions now. How to prevent this. Here are some targeted nutrients that we use to help this process along. Nattoserozyme is 2 products in there, nattokinase, and notice the ACE at the end, and also serrapeptidase. And these are 2 things that help to repair cardiovascular tissue as well as deplaque arteries. Nox Synergy, second product, wonderful for improving a person's nitric oxide levels to protect cardiovascular tissue. And at the very bottom, Vessel Forte, high bioflavonoid complexes designed to repair cardiovascular tissue. Now, this isn't everything, but this is a few items that we use. Depends on the person. So prevention and solutions. Something that we haven't spoken about yet is the regulation and control of heart function and of calcium metabolism and of blood lipid metabolism, meaning fats in your blood, right? The cholesterol levels. Autonomic nervous system comes directly from your brain, and this is the side of your nervous system that automatically runs and regulates all your organ systems, including heart rate and rhythm and heart function completely. So one thing that we do there is called biocranial. It's very unique to my office, but it improves your autonomic nervous system. The better your autonomic nervous system is, the healthier your heart can be, and the healthier you can be. Targeted nutrients to either deplaque arteries and or work on blood sugar reversal issues. Dietary lifestyle changes, in other words, diet is critical and foundational. Your body is not a sack of drugs and chemicals, but it's a sack of food and nutrients. So therefore, your diet is critical. If we're trying to put out this fire going on inside your body and the fuel to the fire is your diet, we've got to address that. Otherwise, things never change. Lastly, exercise. Exercise is critical, but you need to do appropriate types of exercise that are just for you and progressively move your way up to ultimately, foundationally have a healthy heart. Does all of this make sense to you? Hopefully it should. This is the summary slide that kind of covers everything. Cardiovascular disease is the #1 killer. What causes it? Obesity, insulin resistance, diabetes. Those are huge. Blood sugar problems cause heart disease, plain and simple. Blood pressure can as well, but again, blood pressure, what's causing that? That's the thing that you want to address. Smoking. Obviously, smoking causes heart disease. Now, the discovery process would be advanced blood work, a multi-scan pro, and another test that we do, I didn't mention, called heart rate variability. demonstrates, it's a cardiovascular, I should say an EKG test for your heart, but it demonstrates how your autonomic nervous system is doing. And then lastly, heart scan, that coronary artery calcium score. Great process to really determine how healthy is your heart, what direction things are heading in. Lastly, solutions, nutrients, targeted nutrients, improving your autonomic nervous system through biocranial, lifestyle, meaning diet and stress levels. Your stress level also will influence the tightness in your blood vessels and the tone of your blood vessels, which can raise your blood pressure and can be causative to some heart issues. So diet and stress level. Reduction, we want stress levels to drop, obviously, but we would say take inventory on that. And exercise, appropriate exercise that's going to be just for you. Now, some clinical pearls that I wanted to finish with. Number one clinical pearl would be the connection of heart disease with blood sugar. Removing starch and sugar from your diet. It's really critical. There's no way around it. You have to do it and do it progressively, but it's critical and foundational to making sure that you attain really great cardiovascular wellness. Second pearl would be targeted nutrients. I would definitely do that CAC score, the calcium, coronary artery calcium score for your heart, that CT scan. Call my office, 562-860-3404. Talk to Elaine or Marty and get that score, get that testing done. Let's do this thing so you can know where things are at. Because heart disease is becoming younger and younger. People in their 30s are having massive heart attacks, and in their 40s and their 50s. Something that used to be pushed off to like 60s and 70s is now younger people are getting it. Why? Because the massive addiction in this country is sugar addiction, sugar and carbs. So please do that. The last pearl would be, again, analyze your stress level. Take an inventory. Don't change it. Don't fire your family and quit your job right off the bat. Of course, that'd be great sometimes, but take inventory of what stressors are going on in your life, and you might be surprised at what you'll discover. So that's it. If you have any questions, concerns, please contact me. My email, draugustine@gmail.com or info@aheadtowellness.com. My website is aheadtowellness.com, or call my phone number, speak to Elaine, and we'll have a chat. 562-860-3404. I hope this is helpful to you. Let me know. I'd love to hear your comments. Again, thanks for watching. Again, my name is Dr. Augustine. Have a great day.